Good afternoon. My name's Michael Lowe. I'm a geriatrician in Darwin. I'd like to give my respect today to the Larrakia people whose land I'm on. I've been a geriatrician here for about 20 years and I run the memory services for the Northern Territory. People often ask me, what's the difference between dementia and Alzheimer's disease? Well, the word dementia comes from the Latin. De means not, and mens means mind or thinking. So it's just Latin for not thinking well. So if you come to me and tell me that you're not thinking well, and I say you've got dementia, we're just saying the same things in different languages. Now, many people think about dementia as if it's just about the memory. And indeed, it's pretty common for people with dementia to have difficulty with their short-term memory. But there can be other sorts of thinking which people with dementia have problems with. One is with speech, with word finding. So they might be saying a sentence and just be unable to find the right word. Another is visual things where they might not understand what's around them so well, so they might get lost or have trouble putting on their clothes. A third is with mood, where someone might just get angry or depressed for no reason or go wild. Now, we all have some of these symptoms normally, and they normally don't prevent us from doing what we like to do. So dementia is only when these symptoms start preventing us from our day-to-day activities. Dementia is a disease which slowly gets worse over many years. Other diseases behave differently. So for example, delirium is when people become confused very quickly over a day or two, and this is often due to an infection or a drug side effect. So you need to go and see a doctor if this happens. Head injuries or strokes or surgery to your brain will cause your memory and other cognitive functions to fall straight away, but they'll stay at that level then from then on, rather than deteriorating further, or they might even improve. Drink or drugs also cause people to have difficulty with their thinking. However, we've seen lots of people where if you stop drinking or stop the drugs, their thinking improves and can improve more and more until it's almost back to normal after 6 months. There are lots of different sorts of dementia, and these are individual diseases which cause dementia. Alzheimer's disease is one of the diseases which causes dementia, but there are three main ones in Australia. The first is Alzheimer's disease, the second one is blood vessel disease, which we call vascular dementia, and the third is Lewy body disease, which is a disease which gives you hallucinations as well. There are many, many other sorts of dementia. Why should we find out if someone's got dementia? Well, it is useful for someone to know if they've got dementia. First, it helps everyone know the cause of somebody's problems. Secondly, there are drugs that help some forms of dementia, like Alzheimer's disease and Lewy body disease. Thirdly, knowing that someone has dementia allows us to plan for the future. And fourthly, it helps rule out other causes of memory loss that might be treated in other ways. So how do we diagnose dementia? If someone comes to me in the memory clinic, I first talk to the person and their family to try and find out their concerns. We then ask them to do some memory tests. These are pen and paper sort of tests where we ask questions and they try and answer. Then we need to look at some blood tests to see if there are other causes of thinking problems. And finally, we need to have a CT scan or an MRI scan, which will look for other causes of thinking problems, but also work out what sort of dementia the person has. There are treatments available for dementia. For Alzheimer's disease, we have a couple of different pills which we can use. For vascular disease, we be really careful about someone's blood pressure and diabetes and other risk factors. For Lewy body disease, there are tablets for memory and for hallucinations, but often the non-drug treatments are more important. It's very important that families learn a bit how to react to people with dementia. If someone repeats things over and over again, what should you say? Or if someone gets angry for no reason, how should we react? The second is we can arrange activities to keep people occupied at aged care centres or going out on a bus or those sorts of things. Thirdly, we can have respite so that other people can help look after the person and give families a break. And fourthly, there's lots of different services which are available, such as food, cleaning and transport, to allow a person to stay in their own home. Remember, there are lots of people who can help. There's lots of other organisations in Australia to help with dementia. We've got our memory services, but there's also an organisation called Dementia Australia, which helps kids education. There's carers in the Northern Territory, it's called Carers NT, which helps support people looking after people with dementia. And there's Dementia Support Australia, which is an organisation which helps people if they start to have behavioural problems with dementia. Overall, there's a lot we can do for dementia, so thank you for listening.